When dealing with impotence, there's also a psychological component to it, right? Let's talk about how that plays into everything.
Absolutely. The psychological aspect of erectile dysfunction, what we call psychogenic erectile dysfunction, it's actually something organic. When somebody gets nervous, they produce hormones that help us survive stressful situations. It's our fight or flight hormones, okay? We're talking about the cortisols and the epinephrines. These are the hormones that allow us to survive something that may be very dangerous for our overall health. The best way I can describe it is this way. I tell guys, imagine when we were cavemen having sex with our partners. If a big woolly mammoth came up behind you to eat you, what would you do? You'd run, right? Okay, and then I asked him, you ever try to run with an erection? You can't do it.
Right.
Your body prepares you for that. And that's essentially what happens when somebody gets anxious right before they have intercourse.
Okay. Are there certain medications that can make a man's ability to perform difficult?
Yes. Unfortunately and unfortunately, a lot of the medications that are given in order to treat patients for a lot of the medical problems do have as a side effect erectile dysfunction. Now, that does not mean that that gives them a reason to be able to stop their high blood pressure medication, because ultimately, if they don't treat their high blood pressure, they can end up with erectile dysfunction, or even worse, heart attack or stroke, or even death. Okay.
And let's talk about how ED is diagnosed.
So first of all, a patient will come in,
right,
and they'll say, listen, doctor, I have this problem. I either cannot achieve and or sustain an erection that's rigid enough for the entirety of sexual intercourse. Once that happens, then of course I go over a little more history, ensure that they're safe enough. It's safe for them to have sexual intercourse and to take certain therapies. We include certain blood tests in order to check a hormonal profile. Some of them we will obtain an ultrasound just to check blood flow within the actual phallus. But a lot of the actual diagnosis is done with the treatment. If they respond well to treatment, well, it's diagnostic and therapeutic at the same time.